Hello, my name is Erica Nichols, and I am doing my neurological assessment today. This is my room. All right, and these are my tools. Hello, my name is Erica Nichols. I'm a student at the University of South Alabama, and I am going to be doing your neurological assessment today. Can you tell me your name?
Andy.
And do you agree to let me record you and submit it to the University of South Alabama?
Yes.
Alright, so first I'm going to start off by just observing your behavior, your appearance. You are appropriately dressed for the season and your hygiene appears to be good. Then I will assess your behavior. You were able to answer me appropriately a little bit ago. And you're alert and oriented. And then we will assess your mood. Do you feel depressed or anxious?
No.
Alright, and if you did feel this way, we would use a screening tool and go further. And now I'm going to assess your cognitive ability. Can you tell me your name?
Andy.
Where are we?
At home.
And what is today?
Friday.
Alright, so you are oriented ×3. And then we will check your recent memory. What did you eat for breakfast this morning?
Pancake.
And your remote memory. Who was the president before Joe Biden?
Trump.
Alright, and then we will assess your judgment and reasoning. If someone says to you, it's like finding a needle in a haystack, what does that mean to you?
It's hard.
Alright, and if the police got behind you and turned on blue lights, what would you do?
Pull over.
Alright, so your judgment and reasoning is appropriate, and your remote memory and your recent memory is appropriate. And now we'll move on to cranial nerves. And we'll start with cranial nerve number 1. So if you'll just occlude one there, one nostril, and go. Alright, and now do the other one. Alright, cranial nerve number 1, the motor is intact. And now I want to have you occlude one nostril and close your eyes. Alright, and then just sniff. And tell me what that smell is.
Permanent marker.
Alright, now include the other nostril. And can you tell me what that is?
Coffee.
Alright, very good. You can open your eyes now. So cranial nerve number 1, the motor and sensory portion are intact. And so now we'll move on to cranial nerve number 2. Now normally we would have a chart on the wall about 20 feet away, and I would have you read the lowest line while covering one eye. But today we're going to use a handheld vision screener. So I'm going to hold it about 14 inches from your face and get you to read the lowest line you can see while you cover one eye. So will you cover one eye for me? And then just tell me the numbers.
4, 8. 4, 8, 6, 3, 6, 5.
Alright, and so that is 20, 40. You can see, that means you can see at 20 feet what the normal eye can see at 40 feet. And now we'll move on to cranial nerve number 3, 4, and 6. Cranial nerve number 3 is oculomotor. Cranial nerve number 4 is your trochlear nerve. And cranial nerve number 6 is your adducens. And first we'll start with perlite, and that means pupils are equal, round, reactive to light, accommodate, and converge. So we'll start with your pupils are equal and round. So let's look. They're about 3 millimeters in size bilaterally, and they are round. So they are equal and round. And now we'll do reactive to light. So we'll do direct light. So I'm going to shine my light in your left eye, and it did constrict. Shine my light in your right eye, it did constrict. And then we'll do consensual. So I'll shine my light in your left eye, your right pupil should constrict. Alright, right eye constricted. Then I'll do the same on the right eye, left eye should constrict. Alright, and so both pupils react to direct and consensual light. And then we will do accommodate. So if you will stare up at the corner of that cabinet and just focus right on the corner, and your pupils do dilate when you focus. Now if you'll look at my pen light, and your pupils do constrict, so they are accommodating. And then we're going to do converge. So as I move closer you just follow my pen light with your eyes, and they do rotate on their axis. And now we'll do the EO, it says for EOM, so if you'll just follow my pen light with your eyes, not your head. Alright, so pupils do track bilaterally parallel, just do parallel track. So cranial nerve number 3, 4, and 6 are intact. So we've done cranial nerve number 3, 4, and then we're going to go to cranial nerve number 5, which is the trigeminal nerve, okay? So if you clench your jaw, just clench, and then I'm going to try to open your chin, but don't let me, okay? Alright, so cranial nerve number 5, the motor portion is intact. You can relax your jaw. Now I want you to close your eyes, and this is just checking your sensory portion. So just let me know when you feel it.
Yeah.
Alright, so cranial nerve number 5, motor, trigeminal nerve, motor, and sensory are intact. So we've done 5, we did 6, now we do 7, which is the facial nerve. So if you can smile, frown, close your eyes, and I'll try to open, don't let me open them. Alright, and then puff your cheeks, raise your eyebrows, show your teeth. Alright, so try to, the facial motor portion is intact. And for sensory, we would, I would put something sweet or salty on the anterior 2/3 of your tongue, but we're not going to do that today, okay? And so we do, moving on to, that was cranial number 7, we'll do number 8. So I want you to close your eyes and cover one ear, okay? And I'm going to whisper, and you just tell me what you hear.
Football,
Yes, now do the other ear.
baseball,
Alright, so that's cranial nerve number 8. You can open your eyes, is intact. Then we'll do cranial nerve number 9 and 10, which is the glossopharyngeal and vagus nerve. And so if you'll just open your mouth and say ah. Alright, good. Uvula is midline and does rise with phonation. Now we would check your gag reflex with this, and we would do, like, for sensory, something sweet or salty on the posterior 1/3 of your tongue, but we're not going to do those today, okay? And then, so that's 9 and 10, so we'll do 11. So if you can just try to raise your shoulders, alright, you can relax. Alright, and then if you can just turn your head, don't let me turn it back. Alright, and then do this way, turn your head, you turn it back. Alright, so spinal accessory are equal bilaterally, so it's intact. And then now we'll move on to cranial nerve number 12, which is the hypoglossal. So I want you to stick your tongue out. Right, tongue is midline. And then if you could say light, tight, dynamite. Okay, tongue strength seems to be good. So cranial nerve number 12 is intact. Now we'll go on to your motor system. So if you can stand up. Right, and just start right here at the corner of this table and just a regular walk till about 10 feet, 20 feet. Alright, and wait, just right there. The walk seems to be smooth. Now your tandem walk, which is heel to toe back this way. Alright, I do not see any swaying with tandem walking, and your regular gait was smooth. Now if you can just look this way and stand there with your feet together, arms by your side, and close your eyes. Okay, minimal swaying seen. So you can open your eyes now. We would do that for 20 seconds normally, so Romberg test is negative. Now, if you can just have a seat back on the table. We're going to check your sensory portion. So I want to let you see what's sharp and what's dull while you have your eyes open. Sharp, dull. Now you close your eyes and I want you to tell me what it is, okay?
sharp, dull,
Alright, sensory system seems to be intact. Now we're going to check your reflexes, okay? So this is your bicep reflex. So if you can just flex your arm just a little bit and then relax it against my arm and pull your sleeve up. Alright, I see a little bit of reaction reflex right there, so I'm going to do a 1+. And Now I'm gonna do your tricep. I'm gonna hold it, you just relax it. I'm gonna get the tendon. Alright, I see a small amount of reaction there, so I'm gonna do that at 1 plus in your tricep. Now we're doing your brachial radialis. Alright. Now look, reaction here, I'll do a 2 plus there. And then your patella reflex. And just find it here. Alright, 2 plus on the patella. Now your Achilles. Alright, 2 plus on the Achilles. Alright, so reflexes. Bicep and tricep are going to say a 1 plus in the brachial radialis, 2 plus, patella 2 plus, and Achilles 2 plus. Now we're going to try your superficial reflex, your plantar reflex. So you just put your legs up here, just hang your feet off the end of the table. See if we can make sure you can see it. Let's see, you can't really see it. See. There we go. Okay. So we'll do so I'm just gonna hold it. And this is checking for the Babinski. Alright. Negative Babinski sign. So that's a normal finding. Turn back this way. Alright, and now we will just talk about the Glasgow Coma Scale. It's a scale that assesses if the patient is in a coma, and I've been doing that throughout this assessment. It's a 3 score from 3 to 15. Anything less than 7 means that you're in a coma. So for your eye opening, I gave you a 4 because you've been able to open and close your eyes. For your verbal, you have been able to answer me appropriately. I've given you a 5. And for motor, I've given you a 6 because you have been able to do all the things I've asked you, which is a total of 15. So you are not in a coma. And that concludes my neurological assessment.